My name is Barry Schapiro. I'm a board-certified orthopedic surgeon. I've been practicing here in Florida since 2005. I have a certificate of additional qualification in sports medicine. The way I repair a rotator cuff, typically it's done with an all arthroscopic technique, which means we make multiple small incisions around the shoulder and we put a camera in. With that camera we can see everything, and we identify the tear. We do what's called mobilization of the tear, where we free up any scar tissue or adhesions around the tendon. We restore the tendon back to where it's supposed to be anatomically, and we suture it back to the bone using some small implants. That all arthroscopic technique allows for better cosmetic outcome because there's really no visible scars. It allows for quicker recovery because the postoperative pain is much less. Most people use far less pain medication after an arthroscopy as compared to a standard open procedure, and they're back to their usual activities much quicker. The limiting factor is actually the cuff tear that has to heal. That takes a little bit of time to heal, but the actual recovery and the postoperative pain is far decreased when you do it all arthroscopic.